Alright guys, welcome to chapter 41, The Combat Veteran. If you guys are with me, go ahead and turn your books to page 1244 where we can get started in your textbook and you can follow along. Go ahead and take your time to go over the chapter objectives as well as the key terms associated with this chapter. The overview of some of the topics we're going to be discussing today is number 1, your stress response, combat veterans as individuals, PTSD, and emergency care dealing with veterans. Now the case study, we're going to go ahead and go over together and then you can answer the following questions on your own. It says EMTs Jenny Samuels and Dina Middleman arrive at the scene of a minor single vehicle collision. The driver is the only patient, seems to be inordinately angry about having missed his turn and skidded into a utility pole. Police officer on the scene says, "I'm a vet. Something tells me this guy is too. There is something more than this than the accident." Go ahead and pause the video and go ahead and answer the following questions on your own. So we're going to talk about combat veterans. Combat veterans comprise less than 1% of the population and sometimes can have unique challenges related to PTSD. Now, not all combat veterans struggle from PTSD, and not all people who struggle from PTSD are veterans. PTSD can affect anybody who has undergone a significant trauma or stressor in their life. That includes EMTs or paramedics or police officers, or even people dealing with significant accidents or other things or stressful situations in their life. So we're going to talk about the stress response. Obviously, if you guys remember from chapter 7 or 8, stress response is part of your sympathetic nervous system, which, if you remember, is part of your autonomic nervous system. Your SNS is titled your feed or your rest. Rather, it's actually titled your fight and flight response. Your other nervous system of your autonomic nervous system is your parasympathetic nervous system, and that is titled your feed and breed or rest and digest. Now, both of these nervous systems kind of balance each other out. Kind of imagine like some scales that will balance each other out. And they will help your body either be prepared for action with sympathetic response or a parasympathetic response, help you to kind of relax and go through other phases. Now, in a situation of PTSD, our sympathetic nervous system gets activated and can remain activated. We can also recruit other parts of your body systems, right? Like your endocrine system. We'll recruit your epinephrine and norepinephrine, which are both hormones that are secreted from your adrenal glands. Now, we're going to talk about combat veterans and war era veterans. Each veteran is a little bit different, and each veteran can struggle from PTSD. A combat veteran is somebody who's seen combat, where a war era veteran is somebody who's served but has never seen combat. Now, just because a war era veteran has never seen combat doesn't mean that they can't struggle from PTSD, right? I mean, these guys go through some rigorous training, right? They do everything so that they can go through and respond to the worst circumstances. So just because if they're not a combat vet doesn't mean that they don't have or can't struggle with PTSD. And remember, every single person deals with their own personal issues. It's important that you guys are able to identify veterans. Some will be easier to identify than others, maybe through their haircuts, or maybe the clothes they wear, or even the different stickers or patches that they might have. When you're dealing with combat veterans, try to word questions carefully, right? Don't be rude, and don't ask questions that might elicit a specific response from a veteran. Now, with combat veterans, 2/3 of them can have relationship problems since coming back from serving overseas. 25% of the homeless are veterans, and 2/3 of combat veterans do struggle from PTSD. So that's why we're talking about this. That's why this is an important topic, because this is a big part of our population, and these people served our country. We want to give them the service and the respect that they deserve from us as EMTs and paramedics. Now, PTSD. I'm sure you guys know that PTSD stands for post-traumatic stress disorder. And it can also be a delayed stress response, like we learned about in chapter 2. Now, in the second bullet point, we see here that PTSD is a reaction of a normal person to an abnormal situation. That is a perfect understanding of PTSD, right? We're just normal people that get exposed to abnormal circumstances and abnormal situations, and it's how your body reacts in that situation. Now, in this situation, there is a sustained sympathetic nervous system activity. And typically, some of these memories can linger and possibly even disrupt person's behaviors or even lives. Now, in order to correctly identify PTSD, we need to know that there's actually 4 essentials of PTSD, and you need to understand each one of them. Number 1, PTSD responses can involve feelings of anger, fear, horror, and helplessness. These patients might also relive events through flashbacks, thoughts, or even nightmares. A lot of these patients will avoid anything that reminds them, whether that's physical, maybe scents, smells, maybe even certain things, sounds, or even emotions of the trauma that they underwent. And then a lot of these patients will exhibit anxiety and anger with much time spent in a state of perceived imminent threat. Those are your 4 essentials of PTSD. Make sure you guys understand those and memorize those for your tests. Now, some other signs and symptoms that might come with PTSD are listed below, and we can understand why. Dealing with abnormal stress response. With some PTSD, we do have some physical responses. Some signs of premature aging can happen, more likely to maybe carry some diseases or get diseases. And physical responses of pain, which can be really hard for a patient to isolate and understand why and what's going on. Now, this is an important topic as well, alcohol and drug use. 40% of veterans engage of a pathological use of alcohol and drugs. Well, what does that mean, pathological use? Does that mean they're going out on the weekends having a good time? No, that means they're using alcohol and drugs, right, to calm different signs and symptoms that are going on. Right? If they're angry, or if they're scared, or if they're frightened, or if they feel depressed, they will use alcohol and drugs to make themselves feel better. Now that is dangerous, you guys, and that is bad, and that can actually cause more problems and more damage than good. Now, it's important, you guys, anytime we deal with a patient with any type of maybe even mental or behavioral or psychological emergency, that we ask, all right, this is an important question. Do you want to hurt yourself or anyone else? Now, combat veterans are not more likely to be violent towards others, although their suicide rate is higher than other veterans and then of all other people. And you never know who is going to be able to hurt themselves or other people. So always, always, always make sure you're seen as safe, make sure you are safe, and if you can, talk to your patient and really therapeutically talk to them. It's good to ask these patients if they have a plan to commit suicide, if they've ever thought about it before. And if so, what is their plan? And step in and take the necessary steps to help and give your patient the correct care. With our recent wars in Iraq and Afghanistan, we see quite a bit of veterans who have been affected by IEDs, or improvised explosive devices. They might have resulted in amputations and whatnot, but the large one is actually TBIs, or traumatic brain injuries. TBIs and IED wounds in general have actually been the signature wound from our recent wars in Iraq and Afghanistan. So we'll see a lot of patients dealing with TBI. Well, why is this important? How does this relate to PTSD, you're probably wondering. Right? Well, a TBI, or a traumatic brain injury, can result in a lot of similar signs and symptoms that we see in PTSD. So some of these patients have actually been wrongly diagnosed. They say, hey, you have PTSD. Well, they don't have PTSD. They've actually had a traumatic brain injury from an IED explosion that's happened while they were serving overseas in Iraq or Afghanistan. So how do we determine, right? How do we know if it's a TBI or if it's PTSD? Well, it's really going to be difficult for us to tell. There's a big overlap in signs and symptoms. And that makes it difficult. And TBIs can be very difficult to diagnose. A lot of them can be even missed on different scans and whatnot. So it's very difficult for us to determine. And as an EMT, it's not even our job to determine whether it's been a TBI or if it's been PTSD. It's our job to treat the patient with respect and give them the best care as possible. But regardless, we might see some differences of a TBI versus a PTSD. Here's the list of signs and symptoms that you have in your book. Go ahead and just take a look at them. right? Obviously, we see how many similar are in that list, right? They're all similar. But the one things you might notice about the concussion or the TBI signs and symptoms is that some of them might be a little bit more physical. If we look on the next slide, we'll see a little bit more of the physicality signs and symptoms. Well, you can see head, neck pain, right? Maybe they're a little bit clumsy, right? Maybe they get confused easier. They have blurred vision or dizziness, or they're disoriented, or trouble swallowing. So sometimes they'll have a little bit more physical signs and symptoms. But really, guys, it's difficult to diagnose whether a patient has a traumatic brain injury or if they're struggling from PTSD. The idea here is to remember that these signs and symptoms can overlap in your patient. And sometimes a patient might not have PTSD or might not struggle from PTSD, and then really they're having traumatic brain injury from an injury that they received while they were overseas. Now, one thing we do need to be concerned about with traumatic brain injuries, repeated concussions can relate to something called CTEs, or chronic traumatic encephalopathy. This disease was actually very well portrayed by Will Smith in the movie Concussion. And if you guys have not had the opportunity to go view that movie, please do. I highly recommend it. That will help explain chronic traumatic encephalopathy and actually a lot of the presentations that these TBI patients will exhibit. However, the patient population does differ. Instead of it being veterans, it's going to be dealt with football players. So really, guys, if you have the opportunity, I really recommend that you go see that movie. Take your time to go ahead and answer the following question. Now, when we are assessing and providing care for any of our veterans, be careful the way you word questions. Provide structure, limits. Always leave yourself an escape route if necessary. Remind the patient who you are and what you're there to do. Be calm, but assertive. And establish a rapport with your patient. That goes a long way. Sometimes these patients don't want to seek help, and sometimes they don't want to be fully honest with you. As best as you can, try to get a history, and don't assume that your patient has PTSD. Don't make assumptions and don't make judgments about your patients. Ask if they want to hurt themselves or others, and ask about any weapons. You need to secure those weapons before getting them back to the ambulance with your patient. If law enforcement is on scene, have them search the patient. Explain to your patient what you're doing and why you're doing it. A lot of times they can be very reasonable on scene with you. Try to keep the noise down. Some things might elicit specific flashbacks, such as diesel fumes, dust, or even calling for a helicopter or air transport unit. And sometimes, like all of us, right, these people just have a hard time asking for help. So take your time and just listen to the patient. Show them that you are there for them and you are there because you care about them. That concludes our Combat Veteran chapter. Go ahead and continue to review what you've already learned and continue to read your book. Follow up with a case study. And review anything that you need to in your book. If you have questions, please ask one of your instructors. Thank you guys very much.